started. So I'm really excited to be here today. We are, as you can see, at the Korey Stringer Institute in the Mission Heat Lab. I'm joined by Dr. Rebecca Stearns. Rebecca, thanks so much for taking the time to be with us today.
Yeah, thank you for having me.
Yeah, so we're really excited to talk about an important topic. We're going to be talking about sudden cardiac arrest in youth and the things that we can be doing to actively try to prevent young athletes from dying from sudden cardiac arrest. And still, I think as a society, we associate heart disease with, maybe older people, people that aren't healthy, people that aren't fit. And unfortunately, sudden cardiac arrest is the leading cause of death among student athletes across the country. So, you hear about these young, super fit, super healthy, or people that we think are super healthy athletes that drop on a football field, on a basketball court, on a soccer field. And when it happens, and unfortunately a student athlete passes away from sudden cardiac arrest, it's a very devastating event for not only the family but the community. So thankfully we're here with Becca to talk about the Korey Stringer Institute and all the amazing work that they are doing to prevent this from happening to young people. So again, thank you, Becca, for being here. So before we kind of get into KSI and all the amazing stuff you're doing, just want to kind of hear about your background and what made you want to get into the world of sports medicine and athletic training.
Yeah, so my background is in athletic training, and so I was an athletic trainer for my undergraduate degree. I went into athletic training because I loved sports myself. So selfishly, I was an athlete and I loved being active and all the positive things that come about when you are when you grow up in a sport family, I'll say. So I knew that I wanted to go something related to that field, and I just generally had an interest in health medicine. And so I thought that athletic training was a great mix of all of my interests. And so I did my athletic training degree, my undergraduate degree, and then I pursued a master's and PhD at the University of Connecticut in exercise science, because then what I ended up doing was finding my love of research. And so what I did at UConn was pursue this development and expertise also in how to produce research and enhance the knowledge and evidence that we have behind a lot of the things that can help athletes in terms of performance and also safety.
That's awesome. So you did your undergrad at Duquesne, and you were a student athlete, and then you came to UConn, and I don't think, have you left since you came back? Or?
No.
Yeah. Okay, cool. So you were kind of here for, I think, the beginning of KSI. So can you just kind of talk about, the mission of the Korey Stringer Institute and a bit about the background of the story? Because I think that's really inspiring, why KSI even exists.
Yeah. So Korey Stringer, he was a Minnesota Vikings offensive lineman, and he passed away in 2001 from an exertional heat stroke. And so in the wake of his death, his widow, Kelsey Stringer, wanted to create something to honor his memory, but then also prevent future instances of catastrophic injury in sport. And so she came to UConn because of our CEO, Dr. Doug Casa, and his well-known expertise in thermoregulation research and specifically heat stroke. And so that's why the Korey Stringer Institute was founded at the University of Connecticut, because of our reputation in research and the area of thermoregulation. So we were founded in 2010, and so we've been going for 12 years now. And I have been fortunate enough to be involved with KSI ever since the beginning. And so I was just at the tail end of my PhD work when we started, and have been able to be involved now 100% vested and work at KSI every day.
That's awesome. I know we're talking about sudden cardiac arrest, but can you just talk a little bit about kind of like the mission? Because I know you all, sudden cardiac arrest is one of your focuses, and obviously it's one of ours at Defibtech, but just really quickly, some of the other things you focus on other than sudden cardiac arrest as well.
And so I'll touch on our mission, I guess I should say.
Yeah.
So the mission of the Korey Stringer Institute is to help enhance sports safety, performance, and health and safety for the athlete, warfighter, and labor, specifically as it relates to preventing sudden death in sport and catastrophic injury. So we know that cardiac is the #1 cause of sudden death in athletes. So it by far makes up the largest number of athlete deaths that we see every year. So that is one of our primary focuses in all of our initiatives and goals when we are executing our advocacy and our grants and our research as we are out there in the field trying to help prevent catastrophic injuries.
Yeah, it's yeah, like you said in the beginning, it's just like always devastating when you hear about these young people that are just doing something they love, and you know, unfortunately, you hear about these deaths that just sometimes are preventable, which I know is what you all are working to prevent them. So, I just want to talk a little bit about, you know, you guys have a lot of different programs going on. So, can you starting with like the Atlas program, if you could just kind of talk about that. And also, it might be a good idea to mention, you know, how schools can get involved with it if they aren't already participating in the Atlas survey.
Yeah, so ATLAS stands for Athletic Training Locations and Services, and it is a nationwide database that tracks athletic training services at every single high school in the country. So we had a large labor force behind this, as you can imagine. Tracking every single high school in the United States took a bit of work, but the value in that is that we know the care that every high school athlete has and the access that they have to an athletic trainer who's primarily the person who's going to be able to respond in the event of a catastrophic injury. They're the person, the medical staff who's there every single day to work with those athletes. And so from Atlas, one of the biggest things we've learned is that just over 60% of athletes have access to an athletic trainer, which means around 33% of athletes don't have any access to a medical professional while they're participating in sports.
Yeah, I remember first learning that from you all when I first started, you know, working for Defibtech and our partnership, and I was blown away because, you know, growing up, you know, in my town, we just had an athletic trainer in high school. So if we, you know, we talk about catastrophic injury and how it's crucial for them to be there, but also athletes that sprain their ankle in practice and don't really know where to go because there isn't someone there advising them. So it's so surprising to hear that so many kids out there don't have access to these services. So just want to kind of another program that actually kind of addresses this issue is Innovate. And if you could just kind of talk through, you know, the Innovate program and the goals for that.
Yeah, so the Innovate program started 2 years ago, and it is a $3 million grant program that has been started to help infuse athletic trainers into underserved areas and populations where there typically hasn't been athletic training services before. So the grant is meant to help get athletic trainers into these spaces, into these school districts and schools, so that they can start to build the foundation of sports medicine in those locations. And hopefully then that is the foundation that can grow further care for those athletes. So we're going into the third year. It's the last round of applications this year. So anyone can find more information on our website if they'd be interested in applying.
Definitely. That's so amazing. Again, to be able to offer or help schools start this program, which could potentially save lives, just having an athletic trainer there on site. So I know you spend a lot of your time working on the TUFS program. So I just want to kind of cover that, what the program is and you know, some of the great progress you've made with it.
Yeah, and I think one of the key items with these programs in particular is they all work very connectively with each other. They're all very dependent and they all serve to help support each other. So Atlas provides us a ton of data and information. Innovate actually helps to deliver that care. TUFS stands for Team Up for Sports Safety. And this is a program that is sponsored by both the NATA, the National Athletic Trainers Association, and the NFL. And it came together with the hope of propelling policy adoption forward faster, specifically for high school athletes, and policies that are related again to preventing catastrophic injury in sport. So we know, we already talked about cardiac, but this program targets the 4 conditions that are responsible for 90% of the deaths. So that's cardiac, cardiac, heat stroke, head and neck injuries, and exertional cycling. So those make up 90%. So that's the effort in this program, is that we go state to state, because that's essentially how high school athlete health and safety policy is governed. It's governed at the state level, usually either through law or through the State High School Association or through maybe the Department of Ed. But we work with the stakeholders who are responsible for those policies and find ways to close the gaps between what's currently in place and best practice policy that will help eliminate and or reduce the deaths that we see.
Yeah, And that's important because I think, you know, you can do a lot of small things in different communities, but real change happens, I think, when there's policy or legislative change. And I've been lucky enough to attend some of the meetings and see some of the progress that's been made, and it's just always really inspiring. So so I just want to kind of talk about, like, so you've kind of been here, you know, from the beginning. You've seen the organization grow to, I mean, I'd imagine when you started, it was a very, very small staff to this great, you know, organization where there's staff, students, and you have so many people working for you. Just kind of curious, like, what are some of like the biggest wins that you've seen, you know, over the course of, you know, the last 12 years?
Yeah, wow.
I know. We have a lot of time, so yeah, you can.
I think, and I'll talk about some of the wins, but I think one of the things that I've learned in seeing the growth and being with KSI since the beginning is that there was a true need for an organization like us. And I think that we're able to push these policies forward faster because of our expertise and also a lot of the research that has come out. And so I think that's one of the biggest things that I've seen in my time here is that the evidence that we have now behind these policies, because of our ability to not only track and monitor the injuries that are happening, but then look at what's happening when we implement these best practices. We've seen massive reductions, and the data and the support for them is out there now, where I don't think there's any question about what we need to do. It's just a question of about when are we going to take those actions.
Yeah, that's awesome. Yeah. So just kind of, I guess, to give some advice maybe to youth sports organizations, schools, fields, athletic facilities, you know, what steps should they have in place to ensure that, you know, if a young athlete goes into cardiac arrest at their facility, that this person has the highest possible chance of surviving?
Yeah. And you've probably talked about this before, but I think this is incredible, being that cardiac arrest is the #1 cause of death in athletes, and that it is probably the most time-sensitive condition that we talk about. So clearly the survival rate dramatically drops for every minute that passes, right? So we have the smallest window to work with, but the data that we've seen and what we know is that if you have 3 things in place, you can have nearly a 90% survival rate, right? And so if you have the event is witnessed, right? There just has to be somebody to act on behalf of the athlete, right? Hopefully in most scenarios, there's going to be somebody there that can do that. Second one is having an emergency action plan. And that is simply a plan of what is going to happen if an emergency takes place. And it's a 1-page document that gets posted at every venue, at every school, or whatever organization it is. And so that has things like names, phone numbers, the address, the GPS location, the access points to the fields, so that there's not a delay of care simply because an ambulance couldn't get onto the field or something else that could happen, right? So if you have it witnessed, you have an emergency action plan, and then of course you have to have the AED, right? So you get the AED placed within the first 1 to 3 minutes, and we've seen survival rates as high as almost 90% when those 3 things are present. So those are the biggest tools we can have in place to save these athletes, and 2 of those cost nothing, right? And so I think that that's huge, and for it, again, for it to be the #1 cause of death and to have a survival rate that high, I think is really encouraging.
And speaking of emergency action plans, I know you guys have some like great resources on the KSI website. Is that a place that, you know, people can go to get like templates and other things kind of to help set them up, or not just cardiac arrest, but other catastrophic injuries that you talked about?
Yes. So we try to make it as easy as possible. We want everyone to steal everything that we have on our website. So we do have templates. We have examples of an emergency action plan so that someone a school can go in, take that template and put in their own site specific information so they can take that. We have templates for also a heat policies and procedures manual, and many other things like a lightning policy as well. So we have many resources on our website that I hope people will go to, see, download, and use.
Yeah, cool. So I want to talk a little bit about kind of what we were here doing today, because we've been here all day, and we have some of our employees from Defibtech that are running for KSI as charity runners in the New York City Marathon. And we're sitting in the Mission Heat Lab. So can you kind of just tell people what you all do in here and a little bit about what we did today?
Yeah, so this space is our premier basically laboratory space. This is where we work whenever we do our research, whenever we have services or people coming into our lab, either because they want to maximize their performance or because they're recovering from maybe a catastrophic incident and they just want more information about their readiness to return. So this chamber allows us to completely control the environment around us. So we can test very extreme high temperatures and very low temperatures. And we have equipment as well so that we can have people on treadmills or bikes and many other devices and measure things like their sweat rate, their sweat electrolyte content. We measure body temperature, heart rate. We look at their aerobic capacity with the VO2 max test. We do a lot of different things in here to support the physiological testing that we do, either the community or also through the grants we receive.
Yeah, I know we had a great day. It was a great opportunity. Everybody that came down to, a lot of people were saying it was like, so happy that they would have never had an opportunity to do something like this. And it's going to be so beneficial for them. I think learning how they can have their best and safest performance on race day, which is huge. So just want to kind of talk about, I guess, look into the future a little bit. And it's impossible to predict the future, but I guess if you could, see where all the work you're doing now and fast forward to like 2030, which is a tricky question, but I'm just kind of curious what you would love to see in terms, I don't know if it's like policy changes or, more AED placement or screening or whatever. Just kind of curious, if you had the perfect world, what would it be like in 2030, for preventing young people from dying?
Yeah, I love that. So yeah, I think the biggest gaps, the things that'll impact the most are having policies in place that align with best practices. And when I say best practices, I'm saying minimum standards for what should be in place to protect athletes. And we know that that's not happening. When we looked at the states for Tufts, on average, states were implementing just over half of best practices. So that is a very achievable gap that I think we can close. And that's what Tufts is essentially trying to do. And so getting the equipment and the policies in place, I think, is going to be the biggest step. And then the very final step will probably be getting medical care for all of the high school athletes. So in my dream world, every high school would have access to an athletic trainer.
Right.
Because then you have everything in place, right? You have the policies, you have the equipment, and then you have the person to act. And when you have those in place, we know that we can, again, save lives and have a really high success rate.
Definitely. So for people that want to get more information about or reach out to you or anybody here at the Korey Institute, what's the best way to do that?
So our website is probably the easiest way to get in touch with us. It's ksi.uconn.edu. And we're also on Twitter, Facebook. So if you want to stay up to date on everything that we're working on, that's a great way to do it as well.
Awesome. So, well, thank you so much, Becca, for taking the time to be with us today. At Defibtech, we take a lot of pride in our mission. We're an AED manufacturer, so, we're trying to place our AEDs as much as we can to ensure that survival rates from cardiac arrest are really high. But our mission is just to help prevent death from sudden cardiac arrest and help save more lives. So aligning with an organization like the Korey Institute has been just an incredible experience for us. So we really thank you for all you do, and we're excited to continue to partner more in the future.
Yeah, likewise. Thank you.
Yeah, so thank you everybody for being with us today. As always, if you need to contact Defibtech, you can visit www.defibtech.com, and we will be sure to help you no matter the size of your organization with any of your AED needs.